Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here today with the Tinkerbell plastic surgeon, Dr. Millicent Ravello. How are you doing?
I'm doing really well. Thank you. How are you?
I'm good. I'm very interested to hear about your Tinkerbell plastic surgery moniker that's coming from multiple directions at your hospital and the surgery center and from your patients. Why is that?
I don't know. I had a surgeon who has since retired I used to work with several years ago, and that was always his nickname for me. He called me Tinkerbell or Tink. Hey, Tink, how's it going? He even got me a little surgeon scrub cap that had Tinkerbell all over it. So to this day, he still calls me Tinkerbell. And then today I had a patient that I was working with in the procedure room. I was doing a little procedure on her. And she's like, yeah, I'm sending one of my friends to you, or I told her about you. And I described you as like Tinkerbell with a scalpel. Because you just, you float around and you have all these little fine movements. And then, hey, you look so pretty.
It's totally true. You are the Tinkerbell plastic surgeon. It's awesome.
So there it is.
Better, though, than being the Tinkerbell nose plastic surgeon, which is a hashtag. And if you search it, it will probably bring you to the rhinoplasty surgeons that you do not want to go to.
Oh, no. Unless you want the Tinkerbell nose.
Well, unless you want that. Yeah, these guys basically get rid of the dorsum, like it's flat against your face, and then they leave a nub for a nose that looks like a cartoon character.
Yikes.
It's not pretty to me, but...
No.
Anyway, that's not what we're talking about today.
Not today. That's not it.
So, Tinkerbell, what we are talking about is a little update on the deep plane facelift.
Yes, because we haven't talked about it enough.
Well, and by the way, it's because it's a huge trending topic that people want to know this stuff.
Totally. They totally want to hear about it, and we totally do it. And this is just a little update because I think on the last one, we sort of honed in on, what the deep plane is. And then we had a SMAS podcast to tell us, the anatomy of the deep plane. But now we're going to talk about a few little finesse things that can also be done with the deep plane.
Well, and just for those who are just now joining us, the deep plane facelift basically is a lower face and neck lift where the SMAS, which is a thick layer of fascia overlying the facial muscles, the thickened part of the face that actually does the lifting to get rid of the jowls, etc. The reason it's important is how you address that SMAS, S-M-A-S is the acronym. It makes the difference in terms of the lift. Do you get a more vertical lift? Do you get a more lateral lift? Do you get a good vector? Or do you split it from the muscles of the neck? All those fine detail points are where the battle is won and lost in terms of the beauty of a facelift. Because a lot of people can do a facelift, and as we know, you really see the bad ones and you can't see the good ones.
Right. That's the whole idea, is that you don't really know when someone's had a good facelift. That's kind of the idea. I mean, you can kind of guess because, they're 80 and they look amazing.
Yes, that doesn't happen by the magic wand of Tinkerbell. It happens by the magic scalpel. That's right.
But, I think any probably facelift done in the past 20, 30 years has done something to address the SMAS. That's not new. There's all different kinds of techniques to lift it, move it around in space. And that's like a whole textbook. And so it's not the fact that the SMAS is being treated so much that it's the way that we're treating it that's different with the deep plane.
Right. And so with the deep plane, it's a way to really get a good lift on the jowl, clean the jawline, and then also if you're able to split it from the platysma, because the SMAS, that thick layer of fascia, is actually contiguous with the platysma muscles of the neck. So when you kind of see these neck muscles when you're showing your bottom teeth.
Those bands that show on your neck.
People love those bands.
Ugh, I have so many.
I'm ready. They just need to go. But the point is that the SMAS is continuous with it, so we wind up doing a little split of that muscle from the SMAS, and that's how we're able to get a clean neck contour, get the jawline, and lift the face. The reason that I wanted to bring up the deep plane facelift again is because I think people don't realize that it is part of a total facial rejuvenation. They think when you say deep plane facelift, it means that everything's deep plane. It means you're doing some sort of deep plane brow and some deep plane eyelids and some sort of deep plane lip lift or something. So that it's not. The deep plane facelift is, in and of itself, the lower face and neck. It's a jawline jowl procedure, combined with whatever you're going to do in the neck, which there's many things to do in the neck as well. And we could probably spend a whole podcast on just what we have available to do in the neck to make the neck look beautiful. But in terms of the upper face and the eyelids, you and I prefer to do the entire upper face through very tiny incisions in the hairline, as opposed to many people who cut on the face, which, we see that a lot, where the deep plane facelift ends at the sort of the level of the sideburn. They then carry the incision up onto the face, onto the side of the cheek, etc. That's not our gig. We don't do that. We can. It's just not what we choose to do.
Different technique.
Right. And we choose to make a basically 1-inch incision at the temporal crest on each side of the head, get down onto the bones and do an endoscopic brow lift, mid-face lift, cheek lift for the upper face, which really minimizes the amount of scars that you see on a patient.
Right. And it really allows you to get down to the mid-face, to the deeper structures of the cheek, because a facelift alone, deep plane, whatever kind of facelift, lower facelift, like you said, addresses the jowls, the jawline, the neck, but it doesn't do a whole lot for anything above the cheekbones. So if your cheeks have started to fall, which everything does, you need a procedure to lift them. And the mid-face and the endoscopic mid-face does a really excellent job at lifting that cheek up and over. And so you're really getting a lift of the mid-face there as well.
Yeah, it's very powerful. In fact, one of my buddies who is a plastic surgeon in New Zealand commented on, I posted an 8-month video today of a post-op full facial rejuvenation, a natural lift. And his comment was, wow, the volume looks incredible. How much fat grafting did you do? And I said, there's very little fat grafting. I happened to do some, but it was probably 8 to 10 cc's of fat grafting. What it is that mid-face lift really gets the cheeks to look rejuvenated. They look natural.
And full.
Full, beautiful. They don't look stretched. They don't look filled. They just look really nice, because it's the malar fat pad, this fat pad over the cheek that you're lifting up and putting into the position over the high point, the cheekbones, the zygomas, and man, does it look great.
Because that's where it's supposed to be. So, I mean, I say this
when you're 30.
Nauseam. Yeah, when you're 30, that's where it's supposed to be. So you can do all these fillers to camouflage the problem, or you can fix the problem. So the problem being that your cheeks have fallen. So how about we pick them up and put them back where they're supposed to be, as opposed to putting a bunch of fat or filler in there to camouflage it. So that's definitely all part of what can be done with a facelift. But it's, like you said, not just the deep plane. It's the deep plane plus to get you all those other things.
Right. And it's those technical differences that I think are what differentiate the natural lift from, whatever named facelift you want to say. I mean, everybody's got some name for it so that the consumer, the patient, can identify, oh, that is the facelift of this doctor. That's the facelift of that doctor. And I got on the bandwagon. I mean, trademarking and everything, the natural lift. I know you're going to laugh and make fun of me, and fine, you should. I think that is appropriate and correct. But, the truth is that people want to call up and say, I want the natural lift. They want to say the name. They want to know that there's some sort of packaging and thought process behind the overall approach to facial rejuvenation.
Right. And, when you have a good name, people like it. There's something to having a name brand facelift.
Oh, yeah. And especially after my one patient shamed me for not having a named facelift. I was like, that's it. I'm naming it then. That's fine. You're going to, and literally went somewhere else and got her whole face cut up I mean, it's so awful. And she still is just like, I really don't know what I'm ever going to do about this. I was like, you know what you're going to do? Nothing. Because there's nothing you can do. Those scars are super permanent. They are all over your face, and that's the way it is. And I'm sorry, I don't know what to say. So, you got to ask those questions because she clearly didn't. The detail points are key. And I don't know. I was talking, I did like last week, I did like 100 primary rhinoplasties. I don't know what the hell was going on, but it was like, I got back from vacation and it was like a deluge of primary rhinoplasties, which was awesome. But all the patients kind of were just like, you just go in there and then you come out and the nose is totally different and it looks amazing. Like, how do you do that? I was like, it's all technical. It's all about the technique. Technique in plastic surgery is everything. That's why you and I get into the weeds about technique on this podcast. It's why people talk about it as a marketing tool, the preservation rhinoplasty and, blah, 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 this facelift and all this stuff. Fox eye procedure. I get people calling me for fox eye procedures all the time.
Never heard of that. What is that?
It's basically a canthoplasty, but it's what you do with it to make the eyes more fox-like, more almond-like, I think is really what it is. And so in fact, I got a patient from back east who's coming for a reversal of their botched fox eye procedure that was done somewhere, and it's crazy looking. That's all I can tell you.
No comment.
You don't even want to touch that one.
I don't. I'm not even. No, we're not going there.
All right. Well, so the point is the technical aspects of how your surgeon does the operation matters. It matters a lot. It's not like, I'll just go in there and get this done. And not that you can discern what it is, and that's the other thing that's the flip side of this is when patients come in and ask questions about technical aspects of the operation that I could answer it and they will have absolutely no idea
what we're talking about. Yeah, it's like if I were to go to the mechanic and be like, so how exactly did you fix that problem? Like what he would say would mean anything to me. I would just be like, oh, okay, sounds good.
Because we don't know.
What do I know?
So that
but is the car fixed? Okay, thank you.
and I do get those patients, especially in revision rhinoplasty, when they've gotten skunked by their first procedure. They come in and they say, I think you need to put a spreader graft here. You need to do this and do that. And they go through it and I go, well, don't you think that we should just do some sort of other dorsal reconstruction graft? Like maybe we should divide the septum and then stagger it and put a different differential graft from the lower part. And they go,
it's like when you only memorize that one phrase in a foreign language and you say it and the person comes back to you speaking like an entire paragraph.
And they're
and
just
you're
yeah, could you speak English instead? Because I don't know.
Je m'appelle Millicent. That's all I got.
Nous allons à la plage. I don't know what you're saying. That's not French. But that's the thing is that you do want to understand that when you're, basically going to somebody to have them operate on you and you say, I'd like a deep plane facelift. Well, that's great. Look at the before and afters, ask where the incisions are going to be, ask what the scars are. Like those things are important. How they do the facelift or whatever, I don't even know that it's important that they do a deep plane facelift. Do a SMAS flap, do a SMAS plication, do a SMASectomy. I don't care which one it is as long as it looks great. And it was interesting because when I was at that facelift course, the facelift extravaganza in Berlin with Vladimir Mitz, one of the guys did present like, this is a plication, this is a deep plane. I'm going to show you, 10, and I want you to tell me which one's which. And half of them are deep planes and half of them are plications. And he would put one up and I'd be like, that's a plication. He'd be like, yes. He'd be like, they put one up. He goes, I go, that's a deep plane. So I could tell because it was obvious which was which to me.
To you.
But all the facelifts looked amazing. Right. It was just, because I know what to look for and what the technique is. That every one of the facelifts he put up looked incredible. They were so good. And that's awesome because it doesn't really matter what the technique is if you understand that you have a good surgeon, that you like their results.
What we say every time.
We do say that every time.
Because it's true.
It's true.
Because it's still true.
Like the results. You got to like the result. I mean, it's true. Like that is the key. So that was all. I just wanted to kind of update everybody on that because I get a lot of chatter in the background about like, oh, who's doing deep plane? Well, a lot of people are. But, it's interesting. My friend Richard Hansen was here today from Ireland, and he he spent some time with a few of the surgeons around the country, and he says there's nobody in Ireland doing the deep plane facelift. So he is going to be the guy doing the deep plane. He's gone with, Andrew Giacono in New York, and he's hung out with he came to see Ben. And so it's like, that'll be great.
You'll be great.
As long as you do a good job.
People will love it.
And he's a really good surgeon, so I'm sure that he will do a good job. He does a lot of noses, and he's like, I need to get into this. Like, I'm getting older. My patients are getting older. I said, absolutely. That happens to all of us.
Yeah.
I know. It happens to all of us, where all of a sudden it's like everybody wants a facelift.
Yep.
I'll be on that train very soon. So anything else about deep plane?
Nope, that's it.
I think that's all, Tinkerbell?
Yes.
All right, cool. Well, then this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.